Our next speaker is Alex Talbott, and Alex worked in NHS communications before leaving to set up his own digital comms events management consultancy alongside his wife Nikki. He was a co-founder of #NHSSM 6 years ago, which has fantastic Twitter chats on the first Wednesday of every month. The last week was about STP engagement. I think there are fewer people on that, but I think there are probably lots of followers rather than contributors because it's such a big topic. You can subscribe to a weekly bulletin on WhatsApp to get some excellent tips and signposts to great blogs and reports. Real must see that one. And he's the author of a brilliant guide on the NHS employers website for NHS staff on using social media, and that's one of the gifts, one of the many gifts that we've got on our gift list for you. So I'll hand over to Alex.
Thank you. Yes, so my name's Alex, and we'll be talking about using social media to engage and consult today. Its subtitle there is an introduction, and that's because this is a huge topic. We've had a very detailed question already about the public sector equality duty, and we'll touch on that briefly, but it's a deep topic, but we'll just skim over some of the most important bits. So I'm managing partner at Superant, and we're a creative agency that's based in Somerset. We work a lot of the time with the NHS and then with some private sector agencies and organisations as well, concentrating on the comms and engagement and events side, so staff events, staff awards, and websites, and a lot of social media training as well. Today we'll be discussing these 5 things. So we're going to start really in the law, so what underpins the need to consult or the need to engage and involve patients and staff in changes in healthcare, and look at the communications. So that's a bit of Communications 101 for some of the healthcare staff here, if you haven't had that kind of training before, but also a refresher for all of us comms people. It's always useful to sort of bring it to the foreground again. And then we'll move on to acting schools. So we've got to try and hold a couple of personas in our own heads. You'll be pleased to hear it doesn't involve role play. It's all up in your own mind. Before moving on to the policy and the social media parts, we're trying to get through this presentation a foundational understanding of what's going on. We're using Slido, but because of the way Slido is working, I've got a different hash, so a different code here. So if you can go to Slido now and put in 2515, you will see the first poll. I'll give you a shout. You can enter your answer straight away, or you can wait until the slide where that question is asked. So it's 2515 for the next couple of polls which are coming up. So I said we'd start in law, and I want to show you first the commissioning cycles. This is a sort of a real massive cog in the healthcare machine. This is what drives the buying and then delivery of healthcare across the UK. And there's 3 key elements, and you'll see in this that the patient is put at the centre, which is nice, it's figurative, it looks good on the graphic, but whether that's the case in real life we'll sort of question in a bit. But there's 3 areas there, all of which involve the potential to include patients and staff in the design, delivery of services, all the way to setting priorities, which services to prioritise over others. And here's the law section. So this is the NHS Act 2006, but the Health and Social Care Act 2012 amended this act. So this is section 13Q, which looks straight to NHS England and says it has a duty to make arrangements to involve patients and the public in its commissioning. Then this section here, so 14Z2 of the same amended act, this looks to CCGs to also make those arrangements, and I've left the pure law words up there because it's mightily confusing, this word secure, I think. And then chapter 2, section, let me remember, 242, that's where the NHS trusts, so the bodies which provide the care, so that's community, mental health and acute. And the ones at the back, so this is planning and provision, development, consideration of what you might want to change, and then decisions which are made which affect the care that you're delivering. So on every single organisation in the NHS is a legal statutory requirement to involve patients in how they deliver